Welcome to the Healthcare Matters webinar hosted by Congresswoman Adams. My name is Caroline Jury and I handle healthcare policy work for the Congresswoman. I'll be your MC today. Today, we'll be talking about everything that's been going on with healthcare recently. We're going to talk about the recent Medicaid cuts, how that's impacting North Carolina, the expiring enhanced premium tax credits, and what all of that means for you and your healthcare. We have a really fantastic panel today of medical professionals here to talk about the impact that they're seeing on the ground and what we can expect in the next few months. Congresswoman Adams will also give you an overview of everything happening in Congress and how that's going to impact your healthcare. At the very end, we're going to have a Q&A session. So any questions that you may have, please feel free throughout the webinar to drop those in the Q&A box at the bottom of your screen. All right, starting this webinar off is Congresswoman Adams. She represents the 12th District of North Carolina, including Charlotte and Mecklenburg County. She is co-founder and co-chair of the Black Maternal Health Caucus, as well as the bipartisan HBCU caucus. Congresswoman Adams, I turn it over to you.
Thank you, Caroline, and thank you to all of our guests for joining us today. I am Congresswoman Alma Adams, and I have the pleasure of representing the 12th Congressional District in Congress, located here in Charlotte-Mecklenburg. I want to thank all of you for attending today's Healthcare Matters webinar, because your healthcare and the healthcare of our entire community does, in fact, matter. I'm honored to be joined today by a talented group of healthcare leaders in our community, Ms. Deborah Weeks, who is the Chief Executive Officer of C.W. Williams Community Health Center in Charlotte. And she's joined by some of her incredible staff from C.W. Williams. Welcome, Ms. Weeks. And also Dr. Doug Robinson, who is a retired physician here in Charlotte, focusing on diabetes and metabolism, endocrinology, and who is chair of the Healthcare Justice North Carolina. And then my good friend, longtime good friend, Dr. Charlene Green, and my personal anesthesiologist. She is a board-certified anesthesiologist from Greensboro and president of the Old North State Medical Society. You're going to hear more from this team of healthcare experts in just a few moments. But let me just begin by reminding folks that healthcare is one of my 4 H's, alongside hunger and housing and higher education, because I know firsthand how important affordable, accessible healthcare is to live a quality life. It's personal to me. I was raised by my mom, who was a domestic worker. She cleaned homes for a living. She worked tirelessly, regularly pushing through pain, because she was determined to build a better life for my sister, brother, and myself. But despite working full-time, my mother still couldn't afford health insurance. And there was no program like Medicaid or the Affordable Care Act for our family to fall back on. My sister, my oldest sister, who is deceased now, had sickle cell disease, which, if you don't know, it's a rare hereditary disease that can cause excruciating pain. So growing up, I spent many late nights in the ER with my sister as she navigated her debilitating condition. And so I often think today what a difference it would have made for my family to have had health insurance. My sister wouldn't have suffered as much as if she had access to comprehensive care and treatment, or if my mother wouldn't have had to work herself to exhaustion to provide for us. So healthcare, as I said, is personal to me. I remember Dr. King saying in a conference back in, I believe it was the 60s, when he said, of all of the forms of inequality, injustice in healthcare is the most shocking and the most inhumane. Affordable, accessible healthcare should be a right guaranteed to everyone, not just the privileged few who can afford it. Unfortunately, though, unprecedented attacks on healthcare this year are threatening the health and well-being of our community. The current federal government shutdown is caused by Republicans refusing to meet Democrats at the bargaining table to pass a bipartisan bill that extends affordable care that extends the Affordable Care Act enhanced premium tax credits. They are a life-saving affordable health care program that's offered through the ACA marketplace. And a number of people have health insurance because of that marketplace. The enhanced premium tax credits, by the way, allow more than 22 million Americans to afford health insurance, including 880,000 right here in North Carolina. And so if these tax credits expire, a family of 4 in my district that would earn somewhere in the neighborhood of $64,000 a year, they would have to pay over $2,500 more annually for the same health insurance. Simply put, Americans can't afford that, and Congress cannot wait to address it. That's why we're pushing to address this issue right now. And so the tax credits won't expire until December. You've heard about that. But open enrollment is going on right now. It's right around the corner, beginning November 1st. Some people are being contacted already. And that's why my colleagues, Democratic colleagues in Congress, have been advocating so hard to get the tax credit extension passed now, not at the end of the year, because at the end of the year, it's going to be too late. Insurance companies have already started sending out notices of mass increases in premiums to customers with ACA marketplace coverage. And so make no mistake about it, this will impact everyone, not just people who use those credits. So without these tax credits, 157,000 North Carolinians will no longer be able to afford health insurance, and they will become uninsured. Patients without insurance costs will cost our hospitals and healthcare providers more, and those costs are ultimately passed on to you. So this can also put incredible stress on our healthcare system, leading to clinics closing, physicians leaving communities, and healthcare services being suspended because they can't afford to operate anymore. For rural and underserved communities, and we have those in North Carolina, that would be especially devastating. The expiring tax credits come after almost $1 trillion in cuts that were made to Medicaid in this big, beautiful, it's called a big, beautiful bill, but it's really pretty ugly because it's going to hurt a lot of beautiful people. And that was signed into law in July. Now, these unprecedented cuts have put an immense financial strain on our state government, and it's estimated that they will cost North Carolina's state budget and hospitals about $32 billion over the next decade. And so North Carolina government will have to balance the budget, and to do so, they've decided to make cuts to Medicaid provider payments, which went into effect October 1. Primary care and especially care providers will see Medicaid provider payments cut by 8 to 10%. Some health and ambulance services will be cut 3%. Hospitals, nursing homes, hospice care cuts by about 10%. And even before these cuts went into effect, providers have been struggling already to make ends meet with low Medicaid provider payments and inflation. These cuts are going to make providers unable to serve Medicaid patients, and we don't want that because they financially just can't afford it. And so this will also have an outsized impact on underserved and rural communities. And I remember a world without Medicaid. And I want to be clear, we cannot afford to go back. I'm not going to stop fighting for your health care needs in Washington because as your member of Congress, what matters to you matters to me. Your health care is non-negotiable, and we can't let working families foot the bill because Congress refuses to act. And as our community continues to navigate the impacts of the government shutdown, and hopefully it won't be shut down much longer, but I want you to know that my office is here to help. And whether you're having trouble reaching a federal agency, not receiving federal services, or if you're dealing with any other effects of the shutdown, please reach out to my Charlotte or DC office, and my staff will assist you however they can. You can contact my Charlotte office at 704-344-9950, or my DC office at 202-225-1510. Now, I am excited to invite today's guest speakers to discuss the ways that they're seeing the government shutdown and healthcare cuts impact the health of our community, as well as answer questions that you have on healthcare. So thank you all for joining us today. I look forward to this robust discussion. Caroline?
Thank you, Congresswoman. Our first speaker following you is Dr. Doug Robinson, again, Chair of Healthcare Justice North Carolina, and recently retired doctor of 27 years. Dr. Robinson, I turn it over to you.
Well, thank you, Congresswoman Adams and Caroline. I'm going to start with some background on the subject of the Affordable Care Act and enhanced premium tax credits, because it's complicated, and yet it's a tremendous success story in American healthcare that's very vulnerable at this time. You're going to hear me expand and drill down on some of the numbers that the Congresswoman just gave you. So enhanced premium tax credits are also called enhanced subsidies, and they make marketplace insurance affordable and accessible for millions. The ACA, as you probably all know, was signed into law in 2010, and it expanded healthcare to millions of uninsured Americans. It eliminated denials of care due to pre-existing conditions. It expanded Medicaid and created a commercial insurance marketplace where folks could buy insurance. Now, typically, these folks were self-employed, small business owners, farmers, ranchers, folks who worked for small companies don't offer health insurance. Often, they were people with low incomes who made too much money to qualify for Medicaid. But the premiums for commercial insurance plans could be expensive. You know, if you have employer-sponsored insurance, there's cost sharing with your employer. But in the marketplace, the burden is all on the individual. Well, fortunately, low-income persons and families could qualify for premium subsidies, also called premium tax credits. Now, along came COVID in the 2020s, and those premium tax credits were expanded or enhanced from 2021 to 2022 by the American Rescue Plan during COVID. They were further expanded and extended from 2023 to the end of this year when they need to be renewed with the Inflation Reduction Act. Those enhanced subsidies were tremendously important. They allowed low-income persons to often have a zero premium, and they allowed middle-income persons to have their premiums capped at a reasonable percentage of their annual income. Now, enhanced premium subsidies, as I said, were highly effective and very popular, and they allowed unprecedented numbers of Americans to get life-saving health insurance. In fact, the percentage of uninsured Americans hit an all-time low, down to just 8% in 2023. In my opinion, it ought to be zero, but we got down to 8, which is pretty good for America. There's now 24 million people enrolled in marketplace plans. Most of those people have enhanced subsidies, and that's an increase of about 11 million from before they had enhanced subsidies. So these work to provide people affordable health insurance. The cost isn't too bad either. It's less than 2% of federal government spending on healthcare. We get a lot in return for that investment, but now there's a tremendous amount at stake if they expire. So just similar numbers to what the Congresswoman gave you. If you're earning about $28,000 per year right now, you pay about 1% of that reasonable cost, $280 in premiums for a plan if you have the enhanced tax credits. Those credits expire. You'll be paying about $1,500 or 6% of your income. On average, it looks like premiums are going to go up about 114% from $900 to about $1,900. Middle income families will hit what's called the cliff in ACA premium terminology. They'll see a tremendous increase. So if you're a 60-year-old couple earning about $85,000 a year, you could see a premium increase of about $20,000 a year. We're getting up to about a quarter of your income you're going to spend just to get health care. Now, to be clear, we're only talking about premiums here. There's still deductibles, and some of these plans have high deductibles as well. So when people are faced with unaffordable premiums, what do? They do what people always do. They're going to budget. They're going to drop their insurance, especially if they're healthy. According to the Congressional Budget Office, we're looking at about 4.2 million people. So another recent estimate from another organization said 4.8 million people who are going to leave the marketplace and go uninsured by the end of 2025 when they get that notice in the mail on November 1st about the cost of health premiums if we don't do something soon. That shift in the remaining insurance pool is going to shift towards sicker individuals who have no choice but to stick with their insurance. So that remaining risk insurance pool will become more costly. So on top of these premiums going up, marketplace commercial insurance companies are on track to raise their premiums by 18% on top of all these other costs we're talking about. As Congresswoman Adams said, this all starts on November 1st. So it's urgent and we can't delay it for another month. It is literally, I don't want to be too hyperbolic here, but it's a ticking time bomb for healthcare in America if we don't get this extended before November 1st. Now, naturally, we all know as healthcare providers and as human beings that just because you don't have health insurance doesn't mean you stop getting sick. And sick, uninsured people will continue to seek care, and this is going to have an effect on our healthcare system in general. It's going to cause more financial stress on our healthcare system, particularly in vulnerable rural areas. An estimated $32 billion will be lost in payments to hospitals, providers, and physicians. Uncompensated care will increase by about $7.7 billion in 2026. So those are the statistics and the facts about this program. I'm going to take my last minute just to zoom out for a second and look at the situation I just described in the context of our American healthcare system. You really have to ask yourself why, in the wealthiest nation on earth, is our patchwork healthcare system so fragmented that people are left vulnerable to losing healthcare if they're denied a subsidy to compensate for the excessive cost of insurance? And it's not just that if you lose your subsidy, you lose your health care. For many Americans, if you lose your job, you lose your health care. And even worse, you better not accumulate too much medical debt, or some people lose their homes. All this is to say that our system of healthcare in America is expensive, complicated, and dysfunctional. Sadly, we are unique among wealthy nations that we don't have universal health care, despite paying twice as much per person. And we have worse outcomes than almost any other wealthy country, including maternal mortality, infant mortality, life expectancy, and all those statistics are worse for people of color. Now, if Congress doesn't act quickly, we're looking at adding another 4 to 5 million people to the 27 million already uninsured in the United States. Let me be clear. Lack of health insurance can result in death. One study estimated that 45,000 of us die each year simply due to lack of health insurance. And that's shameful in a country like America. For me, for Healthcare Justice North Carolina, the answer is clear. We need to extend the premium tax credits immediately and then work toward universal health care in America that will provide guaranteed, stable, quality health care for everyone so we're never put in this predicament again. Thank you.
Thank you so much, Dr. Robinson, for that great overview. Next, I'm going to turn it over to the C.W. Williams Community Health Center team. Ms. Deborah Weeks, our Chief Executive Officer at the Health Center, please kick us off.
Well, thank you, and good morning, everyone. And thank you, Dr. Adams, for inviting us to this platform today. This beats at the heart of not only C.W. Williams and the FQHCs throughout the nation, but America as a whole. I want to defer some of my time to our team because they have some valuable information to share with you. Today, I have with me Mr. Jeffrey McKissick, our Chief Financial Officer, Dr. Crystal Mackey, our Associate Chief Medical Officer, and our esteemed colleague, friend, and partner, Mr. Nick Wharton with the Charlotte Area Fund. And this team worked together throughout the crisis of the pandemic, and we continue to work together today. This is a very frightening time for patients throughout not only Mecklenburg County, but throughout the nation. This, I don't know, and I say this quite often, I don't know that America understands the FQHCs is the largest primary care provider in all of the United States. That's a majority of the patients, not only uninsured, but insured, but the underinsured population. Medicaid is often seen as the underinsured population, and often have many, many more people who are on the precipice of losing insurance every day. I know Dr. Mackey will refer to the consequences of losing health care. Mr. McKissick will share with you some of the financial aspect. But I also want you to understand that North Carolina is the second largest rural area in the United States, rural state. And that means we will lose a number of people from medical attention, from receiving quality health care. That's quite frightening in this day and age in America, that they will not receive care, putting them in harm's way. I will defer now to Dr. Crystal Mackey, who I know has quite a bit of valuable information to share with you. Thank you very much for having us today.
Thank you so much, Ms. Weeks, and thank you, Dr. Adams, for inviting us to discuss this very important topic. As a primary care provider here at C.W. Williams Community Health Center, we have patients that come from all walks of life. We're seeing pediatrics, we're seeing prenatal patients, we're seeing geriatric patients, and all of them are coming to us to help with their overall well-being and health. And what I'm seeing is a direct impact to the amount of hope that our patients are having. I was able to, in the recent months, get patients who had been on insulin for 20 to 30 years to manage their diabetes, to get them off of those daily injections. Sometimes once or twice a day, they were able to discontinue those injections for medications that were able to get them healthier, faster, and control their blood sugars. And now I'm having to tell them that based on our current government processes, that we may have to actually revert back to the care that we had been previously giving them, which wasn't necessarily fixing or controlling their problems. I had a conversation with a patient today who was trying to decide whether or not she was going to be able to keep her ACA insurance or her Affordable Care Act insurance, because she knew that her premium was going to go up by 300% almost, because of some conditions that she has that require specialty care. She's no longer sure she's going to be able to have access to her specialty providers, which is causing her mental health to decline. And that is, to me, the biggest concern. We have patients who I spoke to a patient yesterday about her eating habits for her diabetes. And she said, "Doctor, I can't afford to eat healthy." We're seeing impacts to some of our food pantry and the amount of money that they're being given to help support us in getting patients the adequate food that they need in order to control some of their comorbid conditions. And so it's not just an impact to the medications that they are able to receive, but it's also the other programs that are allowing them to have healthier, overall healthier lifestyles, because the goal is to not just change patients' health and outcomes by throwing pills at them, but to teach them how to live a healthier lifestyle. And so if the support systems that we have with our food pantries, with our 340B pharmacy programs, that's another issue. The patients are not going to be able to receive the medications at the discount that we offer them currently, because we're going to have to buy the medications at a higher price. And therefore, we're going to have to pass some of that on to our patients. So they're going to have to decide, do I get my diabetic medication this month, or do I get my hypertension medication this month? I'm already having conversations with patients about how to prepare for that. And that is heartbreaking, to have to sit down and have a conversation with the patient about how they're going to have to decrease the amount of money that they spend on groceries, because the inflation of groceries has gone up, so that they can afford to be able to see their eye doctor, so that they can keep their vision. This is not just an impact on one stream of care for our patients. I have patients who told me a couple of weeks ago that they're just going to go to the emergency room for everything. They can't afford to see a primary care provider, so they just have to, while they feel well, act well. And then when they get sick, go where the sickest go. And unfortunately, that is just not the best way for our patients to live. Here at C.W. Williams Community Health Center, we do have a sliding scale system that will allow for patients to be able to be seen without insurance. And so we'll be able to meet them where they are to offer them access, but that's not available everywhere. And so we're going to see a lot of patients that just go without care. I think there's an estimate of 16 million patients that will have no insurance by the year of 2034, which is just ridiculous. And so I'm seeing a direct impact in the hope of our patients. Their mental health is really being attacked with the current changes in our Medicaid system. And so I have patients who recently got the expanded Medicaid and were excited about the ability of being able to see all of the different doctors that they need to assist with their medical care. And they've already received notices saying that they're going to be dropped from that. The process of staying on Medicaid is also going to be much more complicated. They'll have to reapply twice a year. And the amount of steps that they have to go through in order to be approved is also going to increase. Patients who were immigrants as children and brought here and given health care based on their DACA status, that may be removed. So we're just seeing a lot of patients that are having a lot of difficulty understanding what the next steps are. And honestly, I have to sit down and tell them, I'm not sure. I'll be here with you. I'm going to do the best that I can, but having a question mark as to where you're going to be health-wise in the next 6 months is a tremendous burden. And I'm already seeing our patients, the change in their overall just mental status. Thank you for allowing me to speak, Dr. Adams. I will hand over the remainder of my time to Mr. McKissick.
Thank you.
Good morning, everyone, and thank you, Congresswoman, for allowing us to speak here. I think my colleagues that preceded me have spoken on basically all of my topics that I was going to cover as it relates to financial and the impact, but I will try to summarize that in a global perspective as it relates to C.W. Williams and organizations across the state and systems across the state that provide health care to vulnerable populations. As we go through these times and we're facing the federal shortfalls and federal cuts on federal programs which allow us to achieve our mission, Medicaid is the second probably biggest payer. So combined with our federal dollars and our Medicaid dollars, that allows us the ability to provide access. And we've used access several times here from my colleagues, access to care, quality health care to individuals who may not have the ability to receive that in other institutions. With those reductions in our fee schedule and our rates, it shrinks our ability to provide access. What it does operationally, it makes us decide, can we afford our team that provides that, our outreach workers, we have to lay off providers. It hurts us in recruiting providers because, you don't work in an organization like ours and across the state and say, I'm going to do it for the love of it. You do it because you're a doctor, but you also need to be fairly compensated for the skill set that you went to school for. So we have to compete with that. And it allows us, it makes challenges on our recruitment and our ability. They wonder, are we stable? Can we afford them from things of that nature? It allows us to reduce our vendor payments, and when vendor payments affect the ability for us to provide medical supplies and medical equipment and providing that care as well. It also creates problems on our workforce because now, as Dr. Mackey mentioned, we went through a Medicaid expansion, which potentially could affect 675,000 individuals across North Carolina. And our team, our eligibility worker and teams, were training individuals on what that looked like and how to be prepared for that now. So now we have to revert and train them on the expectations on maintaining your coverage for those that maintain their coverage and understand that. So now that changes the complexity level where we have to be able to say, hey, it's not necessarily the requirements that are there, but it's the reporting and the documentation and the timeliness in order to maintain that coverage. And if you're in the middle of a treatment plan and you lose coverage, it makes providers like Dr. Mackey difficult challenges that she's mentioned that she has to redivert those treatment plans and modalities from that standpoint. It also has a ripple effect. Dr. Mackey mentioned that our patients say they're not going to come to us. Well, we're a primary care first line workforce where we're trying to keep you out of the emergency room. We're trying to keep you there, maintain some continuities for those diabetic patients and things of that nature so that you have some consistency in primary care. If you go to the emergency room, that creates a cost barrier at the emergency room that's passed down to us in general as private citizens from that standpoint. But then when you come back to Dr. Mackey and to organizations like us, it creates a different problem, because if we've had a reduction in our ability to provide those services because of our rate decreases, because of our shortages in staff, our shortages in ability for equipment, supplies, then it also makes the ability to provide that quality care that we're known for in our mission to our patients from that perspective. So all in all, the rate increases and the dynamics of that affect our ability to provide access to care for the citizens of North Carolina. And that's the main important thing that we're trying to provide, is access to care so that the quality and the lives of North Carolinians are given the respect that they deserve. Thank you. Thank you.
Very quickly, if Mr. Wharton would allow, I just wanted to make mention, this is not hopeless. I want to be clear. FQHC is derived or was developed out of a dire situation, out of the need for housing, out of the need for healthcare, out of the need for homelessness, out of need. We will definitely address and stay and provide and give you as much care as possible. We do have slide scale fee discount program available, which means you pay based on your income. If your income is limited, the least or the most amount that you will pay for a full quality care visit is $35. And then you will negotiate. If that $35 is truly not available, that does not mean you do not seek your care. We will negotiate with you. You must receive health care. Do not defer your health care, please. Thank you so much for that moment. Mr. Wharton.
Yes, thank you so much for having me join this group of distinguished health professionals. And Congresswoman Alma Adams, thank you so much for inviting me to participate. I'm Nick Wharton, President and CEO of the Charlotte area from Mecklenburg County's Community Action Agency. And I'm also on the Community Advisory Board of Advocate Health Wake Forest Cancer Center. And I'm also chairing this year's Taste of Hope American Cancer Society Gala. And as you mentioned, Congresswoman Adams, this is personal, quite frankly. In fact, I lost my mother, as well as my wife lost her mother prematurely to cancer some years ago for a variety of reasons, right? There obviously research hadn't been advanced enough, and today they would be living if, in fact, the research was available. So when I think about community action agencies, and Congresswoman Alma Adams, you've been so supportive of community action agencies. We are 1,000 community action agents across the country, representing close to 10 million individuals and 5 million families. And our specific goal has been helping families to reach economic self-sufficiency. So this period we're in is both historical and hysterical in terms of the impact on low-income families. In North Carolina, there are 33 community action agencies. They serve approximately 54,000 individuals, 33,000 families, and 22 of those programs have Head Start programs, and they work with children at the most vulnerable age. So when we look at the impact of these cuts, poor children, certainly in North Carolina, are facing serious risk, particularly as we look at the cuts in Medicaid. A loss of home nursing for medically fragile children, children with rare disorders who rely on daily nursing care funded by Medicaid may lose access to these services. Very serious. Families fear nurses will have to leave for better paying jobs, forcing parents to quit work to provide care themselves. And of course, without home care, children may be placed in institutions, which is far more costly emotionally and disruptive. We know that important therapies will have to go unheeded. Speech therapy, child development programs, autism services. Community action agencies is also heavily involved in the challenge of opioid addiction. And so all of those are at extreme risk. And so I'm still very proud to to support what Derek Bell, a famed late professor at Harvard University, would call faces at the bottom of the well. And these are individuals that deserve dignity. They deserve our support. And it is outrageous in a country like ours that we're even having this conversation. But the fact of the matter, though, is that we're fully engaged. Dr. Weeks, thank you very much for your partnership, and we'll continue to fight this good fight. I also want to just underscore one last item. I mentioned cancer research. Obviously, the reduction in NIH grants to cancer research has profound implications that will change our lives for future generations. Fewer grants, certainly brain drain on talent. Many scientists are looking at different areas of research, perhaps even going abroad to live out their life ambition. These are serious times, and these are times for serious actions. So thank you for this opportunity to participate, and I look forward to the conversation.
Thank you so much to the C.W. Williams team. You all are excellent as always. Really appreciate you speaking here for us today. I'm going to turn it over next to Dr. Charlene Green, anesthesiologist at Cone Health in Greensboro and president of the Old North State Medical Society.
Yes, can you all hear me?
Yes, ma'am.
All righty. Well, thank you. First of all, I want to thank Congresswoman Adams for having this forum. It is much needed, and she continues to do the yeoman's work for North Carolina to promote healthcare. And I do appreciate all that you're doing to save the lives of not just North Carolinians, but Americans. I think I've heard many of you all talk about some of the things I was going to mention, so I'm going to try to change what I was going to talk a little bit and just maybe highlight some things that maybe you guys didn't talk about. First of all, everybody knows that the $900 billion cuts to Medicaid will be catastrophic. And millions of patients being moved from being uninsured to insured to uninsured will be catastrophic. But I just want to make sure that everybody knows that behind each of these numbers is a person with chronic health diseases, many times diabetes, people who will not be getting the insulin like you guys have talked about, people not being able with their heart disease getting just required drugs such as Eliquis and Plavix that are blood thinners that can help them stay alive. So I'm just going to speak a little bit on just my experience as an anesthesiologist. I heard someone talk about emergency care. So when you go to the emergency room now, many times that wait could be 6 to 8 hours. In the future, it's going to be longer, plus going to be less care because there may not be the staffing that you may need or the money may you need. And from my experience working in the operating room, even before this horrible bill was passed, before I retired, you would see patients who did not have health insurance at times, or did not have that had gaps in their insured care, and they would at times come in with just far gone diseases or ailments that cause really significant sequela or increased morbidities. And so now with this bill being passed, this is going to get worse. For instance, someone that may have a thyroid nodule that can't afford to get a CAT scan or a other testing or see their doctor, they may come in with maybe years later with huge goiters that may affect their health to the point where they can't speak or talk. But more importantly, they could die from surgery because the longer you delay surgeries, the more risk there are. And it's really, really important that we make sure that we let people know that this bill is going to cause catastrophic damage to all Americans, particularly North Carolinians, and cause preventable deaths. I also just want to reiterate about the NIH funding cuts, not just for cancer, but for children and women. There was an initiative initially where our money that had been appropriated by Congress that is now illegally not being, funded. It's going to cause the most catastrophic delay in prevention of medical care and innovations in the next decade or years to come. For example, when I went to medical school, you weren't even doing, I would say in 1990, laparoscopic surgeries was just something that was just still being, researched and things like that. Now, when you get your surgeries, most surgeries are done laparoscopically or robotically. So that research, when I was in medical school, was 20 years before then. Now, if we are not doing research, what are we going to have 25 years from now? And that's going to be, that's really, really important. I think that's really what people are not really seeing as well. From my experience being in the hospital, when people lose their insurance, they just don't stop getting sick. They just, as I said, they just delay care and become more critical. And then what I also saw when people came into the hospital system, I know maybe you guys didn't talk about this, but when you don't have insurance, you still have to pay your hospital bill. And those bills are catastrophic. Many people come into the hospital with these catastrophic bills from in the past, and it carries them on for their lifetime. So now you have, I don't know if you guys talked about this, but medical debt is really, really is significant for many Americans, particularly North Carolinians, and prohibit them many times from even coming to the hospital to get the care that they need. So they die really, really from preventable deaths. The last thing I'm going to mention is just from my experience working in a hospital of just the mental health issues. We have not dealt with the opioid crisis. We have not dealt with opioid overdoses. If you talk to any physicians in a trauma center or any physicians that is a level 1, level 2 center, we're still seeing suicide deaths. We're still seeing opioid overdoses that no one talks about. And that needs to be addressed in addition to funding for mental health for our young people. Before I retired, I would see kids under 12 committing suicides, not just cutting themselves. I'm talking about suicides and deaths. And until we really, really address these issues with funding, we're going to be going down this long path of our communities being really devastated. I also want to definitely give a shout out to the FQACs. I am former president of Old North State Medical Society, so I did work with some of the FQACs, one of which is the Triad Adult and Pediatric Center here, which is phenomenal under the leadership of Michelle Lewis. The FQACs, I'm gonna put in a plug, you guys do the yeoman's work of America. During the COVID crisis, you guys were the center for healthcare in person that many of the hospitals did not even want to touch. So I really appreciate that. But lastly, I want to say that having a daughter that was adopted at 17 months, that was being treated before she was adopted at one of the FQACs, got exceptional care. And looking back at the record with the FQAC that she had, was better than any pediatrician I had seen in this country. So I just want to applaud you all for the work you're doing, and that the funding should not be cut for FQACs. But of course, my thing about hospitals is that we all can work together. There's not a zero-sum game. You guys do great work. The hospitals needs to get funded as well, because who's going to take care of the patients when they have a heart attack? Who's going to take the patients when they have a stroke? When you defund these hospitals, particularly many of the rural hospitals, that increases not only the deaths, but the anxiety of your community as well. I'm going to stop there because I believe that you all probably have talked about many of the things that I would have talked about. If there's any questions specifically for me being a specialist in a hospital, I will answer any of those questions.
Awesome. Thank you so much, Dr. Green. So we are going to go ahead and move into the Q&A portion. Want to make sure we give you all enough time to ask and answer questions. The first question is, with recent budget discussions in Washington, how might potential Medicaid cuts and the government shutdown impact federal funding and support for Alzheimer's research, caregiver programs, and access to memory care services in communities like ours? I'll open it up to any of our speakers that would like to speak on this.
Well, I'm going to take a stab at it because, in fact, the bottom line is ultimately research dollars are going to be cut. All of the major funding that supports indigent care and other care, specialty care, will be cut. So there is very little. I don't know if anybody else has any other specific, Dr. Robinson, Dr. Green, or Dr. Mackey have any other specific responses, but the reality is across the board will be impacted for research and other specialty programs.
I was just going to say, before funding was cut from NIH, they were doing just fantastic work with Alzheimer's dementia work, with amyloid plaques and new drug developments. That has been cut. So the future of, dealing with these diseases is just catastrophic.
Absolutely. And the only thing I'll add to the part of the question on caregiver programs, a lot of Medicaid really does cover these long-term care services. And because of the cuts we're seeing, we are going to begin to see more restricted access to this care. And people may lose coverage for this care. So it's a huge concern and something Congresswoman Adams is going to continue to try and address in Congress before it gets to that point. The next question is, I am a disabled veteran and with disability resulting during deployment to Iraq. How will this impact VA and TRICARE for veterans for myself, who may also use Medicaid to supplement because of limited income?
I'll take that question, and then I'll let any of the other experts see that. From a physician that's worked in VAs, like, all over the country, the last of which was Duke when I was in training, I think that Congress needs to put an emphasis on taking care of our veterans. They're not getting the health care that they need, even at the VAs. The funding cuts have been significant. Many of the VAs that even come to hospitals are not treated the way they should be treated, particularly with the insurances that they have. In addition to that, I'm just going to go out on a limb and talk about something maybe you guys haven't talked about. Many of the people that you guys are seeing that are homeless are the veterans, and they have the most increased suicide rates in our country, as well as hospitalizations for chronic diseases. So when you're seeing ICE coming around and getting people, they're getting our veterans. So I want to put out a plug that we need to understand that all this is intertwined with what the veterans are seeing in all aspects of our society, of how we are failing them.
I'll add to that. I worked in a military facility for several years as a primary care provider. And one of the things that I did see is that our veterans had difficulty getting in to get access of care quickly. It wasn't that they couldn't get in, but there was always a very large wait. And I know that with the funding cuts and the loss of staff, that those wait times are going to be extended, and they're not going to be able to use their Medicaid to supplement using outside facilities to get their care. And so they're going to end up having to wait, as Dr. Green stated earlier, to get a lot of these preventable illnesses in their earlier stages. They're going to have to wait until they're much more serious to get the care for them, because with their limited incomes and then the lapse of Medicaid, it's just going to be much difficult for them to navigate through the VA system.
I guess I'd like to add on a couple. I'm a veteran myself. I actually go to the VA clinic in Charlotte on occasion for some care, and I do VA disability claims, help veterans with their disability claims. So this veteran asked this question, has both Medicaid and VA care. And the point I want to make is many veterans, some people assume that if you're a veteran, you get automatic care at a VA, and that's not true. So there are many veterans who don't qualify for VA care. And probably about 14,000 veterans in North Carolina are on Medicaid alone as their only source of insurance. If Medicaid expansion is reversed in this state, they will lose their insurance. So to be clear, many veterans will lose their only source of health insurance in this state if Medicaid expansion is reversed, as it's likely to be due to the bill.
And can I just say one other thing? This is maybe out of the realm of what we're talking about, but have you ever thought about like why we have so many veterans that are homeless and that are not able to get jobs when we have DoD Department of Defense contractors that don't hire them, and we don't embrace them after they leave the service of getting jobs, and even in our Defense Department. So I think that's something that we need to address at another time too. We should not have veterans that can't get jobs, when we have a Department of Defense that, you know, has all these outsourced people that they don't hire our veterans.
Right.
To
Well,
Dr. Green's
listen,
point, I'm sorry,
if I-
Dr. Adams.
if
Go
I
ahead.
can just jump in and say, I am in 100% agreement with everything that's been said about our veterans, those individuals, and thank you, Dr. Robinson, for your service. But you know, for individuals who go out and fight to protect this country, come back, we should be protecting them. They should have they should have the housing that they need, the health care that they need. We should make sure that we take care of our veterans. With what's lingering right now, veterans are at risk. As everyone else, but they are very vulnerable in this situation. But I just wanted to add, this is why it is so important that the Congress acts and that we deal with this issue of health care.
Absolutely.
Is there another question?
Yes, ma'am. We can move on to the next question. Thank you all for your comments. This is for you, Congresswoman Adams. Do you see any way out of the gridlock with your Republican colleagues? News looks bad, but is there any movement toward the solution to the shutdown?
Well, let me thank whoever for that question because it is very critical right now. And it is important that we. I have seen, or let me just say we are seeing some movement. We don't know exactly to what extent. We want to make sure that because of the current CR does not, it does not do what we know it needs to do. We need to make sure that we come together. Speaker Johnson has indicated that we will have that there will be at least some things that they've been talking about and thinking about. So we're hoping that there is going to be the kind of movement that we need. I'm not sure though. We can't promise, but I do think that because the pressure is being put on, that my colleagues are beginning to see that everyone is being hurt here. This is not a red issue. It's not a blue issue. It's a red, white, and blue issue. It's an American issue when we talk about healthcare. So it doesn't matter really what state you live in. You're impacted by not having healthcare and these tax credits not being extended. So the speaker has said, well, it looks like people are talking, so we'll see what happens. I think that we're seeing some movement already. He says that this is an issue that the House was always planning to address. Well, if that's so, we need to go ahead and address it now, not in December. December, it will be too late. So I think the efforts that are being made right now, the conversations that are being held in communities is really helping to address this gridlock. So we're going to make sure that we keep pushing, and you can certainly depend on me to keep pushing for this bipartisan bill that will reopen government and protect our health care. So thank you for that question.
Thank you, Congresswoman. This next question I'm going to open up to all of our speakers. Someone asked, could you please explain why the cost of insurance is so high? Why do services cost so much, being charged hundreds of dollars for medication?
I can take a swing at that. You know, in the United States, we pay 2 or 3 times as much for our medications as do in other countries in the world. You know, if you look at our GDP as a percentage of GDP, we're at about almost 18, 19% of GDP we spend on healthcare. So why is healthcare so expensive? We've chosen in America to use commercial insurance companies to provide health care for many of us. So employer-sponsored health care is provided through commercial insurance companies. Medicare Advantage is through commercial insurance companies. Many of our state Medicaid programs are provided through commercial insurance companies. These are for-profit insurance companies that have large percentages of overhead and, of course, make profits. If you've seen the talk about the profits that large healthcare insurers reap, a lot of this came to the light with the unfortunate murder of Brian Thompson last year, the CEO of United Healthcare. Tremendous profits these companies are earning. If you look at the overhead for Medicare, a government-run federally provided healthcare payer, it's about 2%. The overhead for commercial insurers is closer to about 15%. So our current system of healthcare in this country has baked into it profit and overhead that makes it very expensive.
I just want to comment on just what you said, Dr. Robinson, and just mention that we have not dealt with the big elephants in the room, which is the pharmaceutical companies and the insurance companies. And I think eventually after we deal with this issue and get healthcare back to Americans, we can deal with that. Did you guys know that in 2022, the Office of Inspector General actually cited the insurance company, particularly the Medicare Advantage companies, for denying 12% of expected or warranted care to Americans? They denied that coverage. And at that point, the CDC and I guess the DOJ was going to investigate it. Secretary Becerra at the time was dealing with that. That has been swept under the rug. It continues to happen that insurance companies actually don't do what they say they're going to do, which is make Americans safer and healthier. They just hoard money and take it, I believe. And I think we need to address that eventually. And most people right now, that if they're trying to get the insurance through the ACA now, starting November 1st, most rates are up to like $30,000 to $40,000. North Carolina is $7.25 for minimum wage. Nobody can afford that. So I'm so glad, Congresswoman Adams, that you're dealing with this issue head on and making doing good work, as Congressman Lewis said that we should do. And I appreciate that.
Thank you, Dr. Green. Caroline, I think we're closing out at least close to the time. I think we're going to have a part two. But I did want to answer a question that has been looming out there about non-U.S. citizens, and that's been at least a talking point from the other side, that we are wanting to give insurance to, and I don't like to call people aliens. We'll say non-documented folks. But let me just say that I do want to speak to it because I think it's important that the community get accurate information. This CR that we're back in debate about does not include the extension of the current ACA credits through November, but non-U.S. citizens are ineligible for federal affordable care tax credits. They've always been. And so they can't purchase health insurance through the ACA marketplace. So I just want people to know that that's untrue when you hear that. So we're going to continue to fight. I certainly am, to reopen government and protect health care. We've got to get our colleagues on the other side of the aisle, the Republicans, to support a deal that will extend health care tax credits that will help. When we talk about just North Carolina, and I think about my district as well, there are 88,000 people just in the 12th district who are who will not be able to afford coverage, who are being covered right now through these tax credits. So we've got to renew them now. November 1, as you've heard, the insurance companies are setting their rates. The rates are going 2 and 3 and 4 and 5 times what they were. And so the notices are going to go out, and once they go out, they're not going to change them. And that's one of the things that we know about. So I just wanted to put that out there because I keep hearing it on the news stations and so forth, and I want people to know that's just not accurate. We're trying to ensure that American citizens are insured and that they can listen. To have access and not be able to afford it is a problem. You've got to have access, but it has to be the insurance must be affordable. Because if you have access, the other thing I wanted to point out, I think it's time for me to make my closing anyway. But let me just say, first of all, I want to thank all of you for being here and participating. The FQACs, thank you. Shout out back to you for all of the great work that you're doing. The other thing that somebody talked about, food and people making decisions between, do I get this medication this month or do I delay it and so forth? Can I get access to food? All of those things are intertwined. And I always say that you can't be healthy if you're hungry. And so we have to think about how these things are interrelated as it relates to all of our citizens. And I thank you, Dr. Green, for talking about the veterans in the way that you have, and the fact that a lot of our veterans are the ones that are being directly impacted here. They're homeless, many of them, and that kind of thing. And that should not be. This is the richest country in the world. There's no reason for people to go without health care. There's no reason for people to go hungry. It's just not acceptable. So I do want to thank all of you. Caroline, I'm sorry I jumped in. I don't know if I was supposed to or not, but this has been not only a lively discussion, but it's been one that I believe that we need to hear. The stories that you have told, we have recorded them, and just know that I'm taking them back to Washington. Because my colleagues need to hear. I think sometimes as politicians, we make decisions and we don't look at the impact of those decisions that we make. And it's the people who come forward, and those of you who are representing people, you're caring for them through the community health centers and so forth, and through your personal practice. You hear the stories firsthand. When someone comes and they say, well, I can't afford to get this insurance, I can't afford to eat healthy. So thank you for sharing what has been shared with you. Know that I'm going to share it with my colleagues so that we can continue to build this case for the need for health care for everyone. I continue to remember the words of Martin Luther King Jr., who talked about how great an inequity this would be if we did not provide health insurance for folks. And for all of the individuals who tuned in today on the webinar, it's been more than 200 based on the numbers I'm looking at. Thank you so much for doing that. And Caroline, I'm gonna turn it back over to you. I think I was a little bit out of order, so I'm gonna yield back to the gentlelady, Caroline Jury, who has been moderating. Thank you so much, Caroline, for doing a great job.
Absolutely. Thank you, Congresswoman, and thank you so much to the speakers. Again, I left it in the message in the chat. Feel free to reach out to our office. If we didn't answer your question or your comment, please adams.house.gov or give us a call at our DC office number. We really, really appreciate you all tuning in, and thank you. Have a great rest of your day.
Thank you.